If you think baby teeth don't matter because they'll fall out anyways, here's a fact that might surprise you. So the health of these tiny teeth can actually shape your child's entire future smile and even more. So from jaw development to speech to confidence issues, these baby teeth can actually play a much bigger role than most people realize. So why do we overlook them? So let's uncover the hidden truths you as a parent should know about your child's teeth. Here's something to think about. What do you believe is the most important habit to teach your kids about lifelong healthy teeth? Now, let me know in the comments down below. The answer might actually surprise you as what we as dentists actually prioritize. So as a general dentist, I've actually seen how many parents actually underestimate the importance of baby teeth until problems actually start showing up. And so today we'll talk about why these baby teeth are actually important for more than just chewing, the surprising consequences of neglecting them, and also simple steps you can take as a parent to protect your child's oral health and also their future smile. Now let's start with the question, why are baby teeth so important? So here's what they do. The first reason is actually they hold space for adult teeth. So baby teeth actually act as natural space holders. So if they're lost prematurely due to decay or trauma, they can actually affect the surrounding teeth, and that can actually leave little room for the adult teeth to come through and to erupt. And this often can lead to crowding and the need for braces. And the second reason is they guide jaw development. So chewing with baby teeth actually stimulates for proper jaw growth. And if you lose baby teeth too early, you might risk having the jaw being developed unevenly, or it might be even underdeveloped. And that can lead to alignment issues down the road. And the third reason is speech and communication. So baby teeth are vital for forming words and sounds. And missing teeth can actually delay speech development and can actually affect a child's confidence. And the fourth reason is nutrition and health. So healthy teeth can actually help children eat a variety of foods, which is crucial for their development. And decayed and painful teeth can actually make them avoid eating, which can impact their overall health. So while these teeth might seem temporary, their role is anything but. Now let's talk about what happens when baby teeth are neglected. So you might think a cavity or two is not a problem because they'll eventually fall out, but the reality is actually far more complex. And here's the ripple effect it can have. First reason is cavities can actually spread fast. So baby teeth are more delicate than adult teeth. And the enamel on the baby tooth is usually more delicate than the adult tooth. It's thinner, which means that it's less resistant to decay. So if a cavity forms on a baby tooth, it can actually spread at a much faster rate than an adult tooth, and that can actually affect the neighboring teeth or even sometimes the adult or the permanent teeth that are developing underneath. So imagine a tiny crack in the tooth. If that's left unchecked, that can spread fast and that can actually cause structural damage to the tooth. And that's exactly how untreated decay works in the mouth. And the second reason is pain and infections. So cavities in baby teeth are actually more than just minor inconveniences, because they can actually cause abscesses within the tooth, and an abscess is an infection. So an abscess is basically a pocket of pus that can form from an untreated cavity and an infected nerve. So an abscess can actually make it difficult for a child to eat, drink, and even sleep sometimes. And here's the thing. An untreated infection can actually enter through the bloodstream, and that can travel to other parts of the body, including the heart. And the third reason is costly future treatments. So when a baby tooth is lost prematurely, they leave behind a space. And what happens is the adjacent teeth which shift into the space, and that can later on create alignment issues, and that would often need braces in the future or potentially jaw surgery if the crowding is severe. Think of baby teeth as nature's placeholders. Without them, the permanent teeth might come through crooked, they might be crowded, they might be rotated, and they could lead to expensive orthodontic treatments down the line. And the fourth reason is their impact on confidence. So a missing or a visibly damaged tooth can actually make a child self-conscious, especially when they're trying to learn or interact with others. And the child may shy away from photos or speaking up during class because they're embarrassed about their teeth. And these early experiences can actually have a lasting effect on their future social development. And the fifth reason is speech and development issues. So beyond appearance, baby teeth are crucial for proper speech development. And missing or decayed teeth can actually make it harder for children to say certain sounds or certain words. And potentially that can delay their language skills. And this can actually affect how they communicate and they engage with the world around them. And here is something most adults or most people don't realize. The habits that are formed in the early years can set the tone for a lifetime of oral health. So if you grow up telling your child it's okay to skip a day or two of brushing and that's normal, these patterns are likely going to continue in adulthood. If these habits continue, that can lead to a lifetime of dental problems in the future. Now let's clear up some myths that many people still believe today, and these misconceptions can lead to neglect, which we know can have serious consequences. So the first myth is baby teeth don't matter because they are going to fall out. And here's the thing. Baby teeth, as I said, are nature's placeholders. So they guide the adult teeth to come through, and they help guide the jaw positions and help guide the proper position for the tooth to come through. So losing baby teeth prematurely can lead to crooked or crowded permanent adult teeth, and that would often require braces and other orthodontic treatments. The second myth is kids don't need to see the dentist until they're older. Now here's the thing. The first visit should happen by their first birthday or within 6 months after the first tooth comes through, whichever one comes first. And with these early visits, we're not looking just for cavities. We're trying to educate parents on how to care for their child's teeth and sometimes even make or help the child get used to the scene of being in the dental chair and in the environment around them. And the third myth is cavities in baby teeth don't hurt. And that is wrong, because cavities in baby teeth hurt just like cavities in adult teeth. And if they're left untreated, they can lead to infections and abscesses just like cavities or decay within an adult tooth. And that can affect their sleeping, their eating, their performance in school. And a toothache isn't just about a child's discomfort. It's a sign that needs immediate attention. And the fourth myth is fluoride isn't necessary on a child's tooth, or children don't need fluoride. And this is wrong, because fluoride helps strengthen the enamel when enamel is still weak once it erupts in a baby's mouth, and to help protect the enamel and prevent it from decay, and we don't want the teeth to be vulnerable from decay, fluoride actually helps strengthen that. So what I suggest we do is use a pea-sized amount when you're brushing, or maybe even a smear layer of fluoride or smear layer of toothpaste, essentially, on an infant. And actually skipping out on fluoride because of misinformation can leave your child's teeth to become more vulnerable to cavities and problems in the future. And the fifth myth is diet is not important for your child's teeth. And again, this is wrong, because diet is important and crucial for oral health at any age. And sugary drinks or even milk before bedtime can actually pool around your child's teeth, and that can lead to rapid decay, a condition called baby bottle caries or baby bottle decay. And if you encourage a balanced diet and avoiding prolonged exposure to sugar or sugary foods or drinks, that is critical to keeping your baby's teeth healthy. The good news is keeping your baby's teeth healthy is easier than you might think. So here's how we do it. The first thing is you need to start early. So I suggest cleaning around your baby's mouth and gums even before the first tooth erupts. And what I suggest you do is you can use like a damp gauze or a damp cloth. Make sure it's not wet. Just clean gently around the gums. And once the first tooth erupts, then you can use a smear amount of fluoride toothpaste using a soft bristled toothbrush. And then when more teeth start erupting, you can use a pea-sized amount of fluoride toothpaste. The second thing is avoiding sugary drinks, especially before bedtime. So always avoid milk or juices before bedtime. And I'd always suggest water. So water is always going to be the safest option. The third thing is regular dental checkups, because early checkups can help us catch problems early. And the other thing is fluoride treatments. So I suggest asking your dentist about fluoride varnishes, because they help strengthen the enamel at an early age, and that can help prevent decay. And also one of the most important things is I suggest leading by example. So here's what I mean. Brush and floss together. Kids love to mimic their parents. So make oral hygiene a fun routine. And these habits not only protect baby teeth, they actually set the foundation for a lifetime of healthy habits. And if you found this video helpful, don't forget to like, comment, and subscribe. Thanks for watching, and I'll see you in the next one.